Hi guys, welcome back to our YouTube channel, Mental Health Happy Hour. My name is Michelle Wangaringanga.
My name is Ngina Maina. For today we'll be talking about anxiety.
So under anxiety, we have the definition of anxiety, we have the causes of anxiety, types of anxiety, signs and symptoms of anxiety, and the interventions for a person with anxiety. So we're going to start off with the definition of anxiety. To me, anxiety is the general uneasiness that an individual undergoes, maybe due to an unknown, because they're in an unknown position, and this leads to tension. Yes.
According to me, anxiety is a disorder that is characterized by a lot of tension, fear, and worries that really affect our daily routines or daily activities that we perform.
Yes. So we have the causes of anxiety, and they're characterized in different ways. And I think I'm going to start with the physical causes of anxiety. And this one mostly revolves around the health situation. Maybe an individual is sick, and this causes a lot of anxiety to them. Maybe they're undergoing some procedures in their daily activities, maybe going to hospital every day. This can also cause anxiety.
According to another factor that I know that causes anxiety, we can talk about poor or our past and or child experiences that we pass through. We'll be talking about children or people who have passed through neglect, physical abuse. Most of them are tending to have anxiety in their lives. Maybe this person is really passing through a lot in their lives. Most of the time they tend to have anxiety in their lives. Yes.
I can also base it under the psychological cause, which is mostly unfinished business. Maybe there's something that you really wanted to do in your life, and maybe you haven't been able to accomplish it and you feel like you're running out of time. That can also be a cause of anxiety.
We also have life situations that we do pass through. There are some experiences we pass through which are very difficult for us, and we tend to have anxiety in our lives. Most of the time when you are having a lot of pressure from work or at school while you're studying, we tend to have anxiety in our lives. Sometimes it may be a good anxiety or a negative anxiety.
Yeah. So we have the cognitive behaviors, the cognitive anxiety, and this is mostly brought about with the I must, I have, I should, which is majorly known as the dogma, revolving your life around the dogma and expecting a lot from yourself.
Also under the life situations, we do have a lot of changes that happen in our life. It can bring anxiety in our life. Let's say for example, an example is when during COVID-19 came, and there's a lot of lifestyle changes, how we are supposed to eat, how we are supposed to work. There was a lot of tension and anxiety.
So we also have the environmental causes. Maybe when you grew up, there was a lot of tension, there was a lot of harassment. This can also cause an inbuilt anxiety. So we can move on to the types.
I have one factors or causes that may cause anxiety. There's some drugs that one may be taking that a side effect may be anxiety. People who are taking psychiatric medications, one of the side effects is anxiety. So that's a factor that we should consider.
Okay.
Yes.
So we can move on to the types of anxiety. I'm going to start with the obsessive constructive anxiety. This is mostly because you crave for perfection. Maybe you want everything in your life to go smoothly, and if that doesn't work out, you tend to be anxious.
I'll also talk about panic attack. We are talking about types of anxiety.
Yes.
I'll be talking about panic attack. This is where one gets unexpected or repeated episodes that are caused by intensive fear. When not really cope with, may cause someone to faint. I'll give an example. When one is you're waiting for an exam, and then you have not really read for your paper that is really coming. And then you're hearing people talking about it, how you're not really prepared for your examination. Once you see the paper, you start having rapid breathing, then finally you faint because you had not really read for your exams. Yeah. That is what we call about panic attack or panic anxiety.
Okay, we also have the phobias, and this is mostly brought about maybe the fear of some animals, maybe snakes, maybe roaches, cockroaches. That can also cause a lot of anxiety.
Also maybe under phobia anxiety, we can talk when someone is really not really used to talk in front of people, you may get anxiety since you're really scared. You know how you're going to tell the people. That is what we call stage fright. Yes.
We also have the post-traumatic anxiety disorder, and this is caused by maybe some events in life that happen to you, and you think that they're going to flash back and happen to you again. Yes.
An example that you can give is tragic accident that really caused harm on a victim.
Yes.
This person may trigger someone from getting anxiety.
Yes.
We'll be talking about another type of anxiety is generalized anxiety. This is where you're just having a lot of fears and worries for nothing that is there. You're just scared for nothing, and you're never provoked by anything.
So we are going to move on to the signs and symptoms of anxiety. We are going to start with the physical or behavioral signs of anxiety, and we can start off with sweating, rapid heartbeat.
We can also talk of inability to concentrate in class. We can also talk about poor sleeping patterns.
Yes.
Sometimes you have difficulty in swallowing because of the anxiety that is really in your body. Unashindwa kumeza chakula vizuri.
You can even have stomach aches, like butterflies. I talk butterflies. Yes, butterflies in the stomach.
And also sometimes diarrhea and nausea.
Yes. So we can move on to the cognitive signs, and that is number one, your thoughts are like scattered. You don't really know what you're thinking. You're unsure of what you're thinking.
Or you're occupying your mind with things that are not really on the world that you're really living. Occupying your mind with things that are not in the presence.
Yeah.
Yes.
And then we have the emotional symptoms. We can start with crying a lot. Yes.
A lot of tensions and worry. Sometimes feeling apprehension. Yes.
Irritability.
And hyper alertness.
And also shaking.
Yes.
But shaking is under the physical. So we can move on to the interventions of a person with anxiety, and you can start with therapy. If you have the panic attacks, especially it's good if you see a therapist. They might be of very good help.
Sometimes you might be not conversant with a therapist. You can also talk to your friend who you really trust, or a parent if you're a kid. Another strategy that you can use how to cope with your anxiety is using relaxation techniques, such as having breathing exercise, such as inhaling and exhaling for 3 minutes so that you can relax.
Yeah.
Yes, you can also do exercise so that you can relax. It's a really good technique to cope with our anxiety.
You can also surround yourself with positive things, like you can be thinking positively. Let the thoughts that are negative evade your mind. Think positively.
Yeah. You can also have a walk. Walking is very therapeutic. It also helps in clearing your mind and being relaxed.
Yes.
Yes.
And we can also, I really like encouraging myself when I'm anxious with this song by the band El Shaddai, the part God give me the serenity to change the things I can change, to accept the things I cannot change, and the difference to know both. That is an encouraging song that you can also listen to. So listening to music is also therapeutic in helping dealing with anxiety.
I really talk about journaling. It's good to write what you're feeling, write what you are feeling at the moment. It really assists in coping with our anxiety. We are done with the topic of today.
Yes, thank you for listening to us. I hope that we have helped an individual out there, and you can reach to us if you're undergoing anxiety.